Welcome friends to this episode of CNS Viewpoint. Today we are going to talk about an important news which I read in September end 2021 when our Prime Minister Narendra Modi had gone to the United Nations General Assembly, where heads of states of all the countries in the world had assembled at the UN General Assembly. So Prime Minister Narendra Modi had made a statement that he has appealed to the vaccine manufacturers worldwide to and invited them to make vaccines in India under the Make in India initiative, etc. So which is of course a great thing, of course, why not? But I was compelled to think about what about reducing delays, unavoidable delays in making sure these health technologies, these scientific achievements and breakthroughs are reaching to the people in need. How can we ensure that the scientific breakthroughs are translating into public health achievements and gains? For example, when the vaccine of COVID can come in 1 year, which is historical, really, then why are we delaying its rollout? If you look at the total vaccination in the world, over 80% has been done in the rich countries and less than 1% in the least developed or low income countries. This kind of disparity, this is when we, the science is clear that we need the world population to be vaccinated, majority of it to be fully vaccinated, if we are to, within a time period, if we are to hope that herd immunity will kick in and pandemic will become history. So despite knowing this, the rich nations have fully vaccinated their majority population, which is great, and they have also rolled out booster doses in several instances. But at the same time, if you look at around the world, you will see the inequitable rollout of the vaccines. So where is the delay? In India, there are 6 vaccines for against COVID, which have been approved, but only 3 are being rolled out. Covishield accounts for over 90% of the vaccination which is done in the country. About 9.5% is or 6% is Covaxin, and 0.4% is Sputnik. Where are the other 3? Why are the figures for Sputnik and Covaxin so low? So also, if you look at non-COVID diseases, you will find that the health technologies for those diseases or illnesses or conditions, you will find they were, the delays were spanned over years. For example, the female condom was approved in 1993, and this is 2021. 28 years after, we still have unmet need of contraception. We all know that we need women-initiated methods for preventing unwanted, unintended pregnancies and sexually transmitted infections, including HIV, but we have unmet need of contraception. When government of India had launched the female condom 20 years back, then why it has not reached every single girl and women who might need it, and other genders? So, where are likewise, if you look at pre-exposure prophylaxis, PrEP, which is an important option for preventing HIV transmission in specific communities and people. It is why it has not been available everywhere across the country in public program and across the world. When US FDA had approved it in July 2012, so this is almost 9 years, more than 9 years after approval of PrEP. We are still wondering when will we get PrEP, when will we make sure that option, that choice reaches every person who is at risk of getting HIV, so that the rate of new infections can come down. So that is why we did this research on PrEP, right? Governments invested, foundations invested in research on PrEP so that we can prevent HIV transmission and give another option for people who are at risk of HIV transmission to prevent themselves from the HIV. So if we fail, if we delay translating scientific breakthroughs into public health outcomes, into public health achievements, then we are really reducing the whole purpose, defeating the whole purpose of doing that kind of research. So, and if you look at tuberculosis diagnostics and research and drugs, if you look at other diseases like such as cancer, heart disease, stroke, the situation is not very encouraging. You will find avoidable delays plaguing the rollout of these new health technologies worldwide. So let's hope, friends, not only COVID vaccines reach every person within a short duration of time, in a time-bound manner worldwide, but also health technologies for every single illness, disease, or condition. They also so that reach every person in need, every person worldwide, whether it's a poor country or a rich country. Health security and social security has to be a norm for each one of us, where truly no one is left behind. If we fail to do this, we will fail on every other SDG also. So with these words, let me conclude today's CNS Viewpoint, and I will be back again tomorrow 5 p.m. India time with the thoughts and views on something interesting. See you tomorrow 5 p.m. Stay safe, stay well, and take care of yourself. Bye bye.